Welcome, everyone, and thank you so much for joining us this Monday evening. We are happy to have you here for our presentation, Don't Throw Away Your Shot, a virtual presentation about flu and COVID-19 vaccines for people who love someone with kidney disease. This event is presented by the National Kidney Foundation of Michigan through a grant from the Centers for Disease Control and Prevention's Racial and Ethnic Approaches to Community Health. Thank you so much to our sponsors and partners, especially Gift of Life Motep, Your Good Village Collective, Michigan State University Detroit Center, Greenfield Health Systems, and thank you so much also to the National Kidney Foundation of Michigan's Detroit Executive Leadership Committee. My name is AJ, Anjanette Davenport Hatter, affectionately known as AJ, and I'll be your moderator this evening. I am an executive at Harambe Care and Your Good Village Collective. My passion and expertise include social justice, health equity, self-care, racism, social work, advocacy, and community empowerment. I'd also like to introduce our presenter and panelists this evening, starting with the amazing Alexandra Ballett Sims. Alex is a public health educator as well as a registered nurse with a passion for educating our community about chronic kidney disease. Alex will be our presenter this evening. I would also like to introduce Dr. Stephen Migdal, Professor Emeritus, Wayne State University School of Medicine, previously Chief of Nephrology, Wayne State University School of Medicine, and Director of Outpatient Dialysis, University's Physician Group. Also joining us is Michael Jones. Michael was diagnosed with kidney disease during his freshman year of college. He received a living donor kidney transplant in 2006. Michael has been working as a public educator since 1993 and currently works as the Title IV coordinator for the Lansing Public School District. Michael is also an associate minister at Union Baptist Church. Great. Finally, please welcome Linda Kilduff and her daughter, Allison. Linda has the firsthand experience that many of you may understand of being a caregiver for someone with chronic kidney disease. Linda and her husband work with Allison and her doctor to protect Allison and to stay healthy themselves. We are thrilled to have this great team here tonight. And at this time, I'm going to hand it off to our presenter, Alex.
Thank you so much, AJ, for that lovely introduction. And thank you to the National Kidney Foundation of Michigan and the many sponsors tonight for having this engaging conversation. Let's get started with the overview of the program tonight. In this presentation, we'll talk about the impact of the flu and COVID-19, who is affected by the flu and COVID-19, as well as vaccinations. And what does this mean for people with chronic kidney disease? We will then answer some commonly asked questions, including your questions from the audience. The purpose of this panel presentation is to provide you with information to make an educated decision about getting the flu and COVID-19 vaccines. So let's talk about the flu basics. Flu is caused by a virus, and it can come on very quickly. Symptoms may include fever, chills. You might feel hot. You might have sweating, body aches. Your bones or joints might feel really sore. You might have a cough or sleepiness and fatigue. The flu virus takes some time to get in our systems, and the incubation period can take 1 to 4 days for it to spread within our system. You can be contagious one day before symptoms develop and can remain contagious 5 to 7 days after becoming sick. The duration of the flu can vary between 3 to 7 days or even 2 weeks or more longer. Let's look at this lovely infogram. Each year, the CDC estimates that the burden of influenza in the US by estimating the number of influenza illnesses, medical visits, flu associated hospitalizations, and flu associated deaths. As you can see here in this infogram, during the 2019 to 2020 season, the CDC estimated the flu caused 38 million flu illnesses, which is the population of California, 400,000 flu hospitalizations, which is the population of Miami, Florida, and unfortunately 22,000 flu deaths, which is the equivalent of a packed Madison Square Garden arena. The burden can vary widely and it is determined by a number of factors, including the characteristics of the circulating viruses, the timing of the season, how well the vaccine is working to protect against illness, and how many people have gotten vaccinated. There were a decreased number of influenza cases in the US last year in 2020. However, flu vaccines were still very essential. Many factors could have accounted for this, including the significant number of flu vaccines administered in the 2020-2021 season and the safety precautions like masking, social distancing to prevent the spread of COVID-19. We do not know how this flu season will go this year. The CDC is preparing for an increased activity compared to prior years. Because there was such a low flu activity since March 2020, there could be an early and possibly very severe flu season. Antibodies that protect against flu have waned over time, which is why we need a flu shot every year. Because there was such a low spread of flu, and because of all the precautions we were taking with COVID, we're relying on the exposure to the virus prior to the 2020 and 2021 season. However, we do not know that we know that the flu vaccine is essential for decreasing the flu cases, hospitalizations, and deaths. So, who is at high risk for severe flu illnesses? People at high risk for developing serious flu-related complications if they get sick include children younger than 5, especially those children younger than 2 years old, adults 65 years of age and older, pregnant women, and women who are up to 2 weeks postpartum after pregnancy, people who have certain medical conditions like asthma, diabetes, heart disease, kidney disease, or extreme obesity. Also, residents of nursing homes and other long-term care facilities. It's also important to note that non-Hispanic Black people had the highest rate of flu-related hospitalizations, followed by non-Hispanic American Indian or Alaskan Native people. In addition to the folks we have listed here, we also want to remember that public-facing, frontline, and essential workers are more likely to be exposed to the flu. In addition, people with chronic conditions are more likely to be hospitalized with the flu. People with chronic kidney disease and patients who receive dialysis treatments are at an even higher risk for the flu. So who should get the flu vaccine? Most of us should get the flu vaccine. Generally speaking, the following people should get the vaccine: everyone 6 months and older, pregnant women, older adults, healthcare workers, people with asthma, diabetes, heart disease, kidney disease, and smokers. Those who should not get the vaccine include children that are younger than 6 months of age, and also people with severe life threatening allergies to the flu vaccine or any ingredient in the vaccine. This might include gelatin, antibiotics, or other ingredients. Vaccines are not perfect, but they are the single best way to prevent the flu. So now is the time to get vaccinated. The CDC recommends flu vaccinations in between September and October. So now is the perfect time to get your flu shot. It takes 2 weeks after the vaccination for your body to develop protection, the antibodies from the flu, so that it's best to get the vaccine before the flu virus spreads in your community. So now that we've covered the flu basics, let's turn to COVID-19. Like the flu, COVID-19 is a very contagious respiratory illness that is also caused by a virus. COVID-19 can spread more easily than the flu and causes more serious illness in some people. It also can take longer before people show symptoms, and people can be contagious for longer. It spreads when an infected person breathes out droplets and particles that contain the virus, like coughing and sneezing. And that's why it's very important for us to wash our hands and to cover our mouths with masks and our also nose. Symptoms include, but are not limited to, congestion, runny nose, cough, new loss of taste or smell, fever or chills, shortness of breath, or difficulty breathing, muscle or body aches, fatigue, nausea or vomiting, and or diarrhea. Because of the symptoms of flu and COVID-19 are so similar, it may be hard to tell the difference between them based on symptoms alone, which is why it is so important that we are testing ourselves for COVID-19 to confirm a diagnosis. Symptoms for COVID-19 may appear 2 to 14 days after exposure to the virus, and anyone can have mild to severe symptoms. As we look at this chart, the US recently surpassed 42 million COVID-19 cases since the start of the pandemic. In the US, over 684,000 people have died from COVID-19 since the start of the pandemic in 2020. COVID-19 cases, hospitalizations, and deaths have generally increased since the beginning of summer, fueled by the spread of the highly contagious Delta variant. Although most people with COVID-19 get better within the weeks following illness, some people experience post-COVID-19 conditions. A recent CDC study shows that adults who had COVID-19, including milder cases, may experience ongoing health problems that can last 4 or more weeks after COVID-19 infection. Who is at high risk for severe COVID-19 illnesses? Certain people have high risk for severe illness from COVID-19, including older adults and people who have certain underlying conditions. Adults of any age with the following conditions can be more likely to get severely ill from COVID-19. This is not a complete list, but we know that older adults, people with cancer, chronic kidney disease, who have had a solid organ or blood stem cell transplant, with those with diabetes, who have been pregnant or have recently been pregnant, who are overweight or obese, and those with lung or heart conditions are more at risk for severe illness, including higher risk for hospitalizations. Who should get a COVID-19 vaccination? COVID-19, the CDC recommends all people ages 12 years and older get vaccinated, including people who have had COVID-19 or a post-COVID condition. The COVID-19 vaccines protect against severe illness, hospitalization, and death. The vaccines are safe and effective and free. There are different types of vaccines available in the US, and they may require more than one dose. It is important to note that side effects are possible, but many side effects are normal. And if you have severe side effects, then your healthcare provider will be there by your side during that time, because it takes 15 to 30 minutes of observation during that time to observe for side effects. The CDC does not recommend one kind of vaccine over another, and your body typically builds the greatest protection against the virus that causes COVID-19 about 2 weeks after you are fully vaccinated. We can't have this conversation without talking more about health disparities in our community. We know that there are disparities and long-standing systemic health and social inequities that have that put various groups of people at higher risk for illness like the flu and COVID-19. Studies have shown people from racial and ethnic minority groups experience an increased burden of both the flu and COVID-19. People in minority groups are often younger when they develop chronic medical conditions and may be more likely to have more than one condition. People with disabilities are more likely than those without disabilities to have chronic health conditions, live in congregate settings, and face more barriers to healthcare, such as access to health insurance or transportation to their primary care provider appointments. The US also has a history of racism and injustices. For example, the Tuskegee syphilis experiment and other experiments. Those incidents have led to medical mistrust. And this medical mistrust can mean that some people do not seek or want the vaccines or other preventative care because they do not trust the healthcare system. What does this mean for people with chronic kidney disease? Well, there's a lot of information here. So, what does this mean for people with CKD? Vaccinations for flu and COVID-19 are especially important for people with CKD because they are at highest risk of developing serious complications and sometimes require a stay in the hospital or even have to be admitted into the ICU. The National Kidney Foundation and the CDC recommend everyone, especially persons with chronic kidney disease, get a flu vaccine every year. They also recommend persons in this group get fully vaccinated against COVID-19. Chronic kidney disease causes a decreased immune response and increasing vulnerability to infections and illness. People with chronic kidney disease face a greater risk of getting sick and developing severe illnesses. Among people with CKD, vaccinations have been associated with reduced hospitalizations, and all studies have showed that vaccinated people have lower severity of illness if they do get sick. The morbidity and mortality of the flu and COVID-19 is much higher among patients with chronic illnesses such as CKD. And that's why we are emphasizing the importance of getting your flu shot and your COVID-19 vaccination as soon as possible. Strategies for families to take action against the illness. So, what should families do to take action? Here are a few steps and reminders. For example, many of you know that people on dialysis can get their vaccine right at their local unit. But folks with chronic kidney disease aren't the only people who can get vaccinated. Everyone 6 months and older in a household can protect their loved ones by getting a flu vaccine. And everyone 12 years and older can also protect their loved ones by getting their COVID-19 vaccine. In addition to getting vaccinated, we can and should take everyday preventative actions to stop the spread of germs that cause respiratory illnesses, like wearing our mask and washing our hands. We can also protect our loved ones by isolating ourselves in the event of illness, quarantining, and by keeping a 2 week supply of regular medications at home at all times. With work work with your doctor or healthcare provider to arrange the needed vaccines. And remember, questions are good and normal. We be sure to ask a trusted healthcare professional and ask questions instead of relying on things that you may have heard on social media. Speaking of questions, now is your chance.
Thank you so much, Alex, for this great presentation. It's reasonable to have questions about these viruses and about the vaccines. We'd like to address some of those questions now with our wonderful panel. I'll start by bringing up Dr. Migdal to answer our first round of questions.
Thank you, AJ. This was really so far a great presentation, a good summary of the problems that we have to deal with, and hopefully some of these questions will help clarify what people are still concerned about.
I agree. And we're so happy and honored to have you and your expertise to kind of flesh out some of these questions that a lot of people had. Some in advance, we're hopeful that some will come through later as well. So let's start with our first question. Will the flu shot give me the flu? That's a big one.
Yeah, that's a big one. That's kind of why we're doing this whole presentation.
Absolutely.
Because a tremendous number of people have the misconception that flu shots cause the flu, and that's one of the reasons many people don't take the vaccine. Mm-hmm. The reality is that flu shots, there are not too many things we're absolutely certain about, but one of the things we're certain about is getting the flu shot will not give you the flu. Now, in order to understand this, you have to understand that when you're vaccinated against the flu, the vaccines are composed of either killed or inactivated viruses, or they're composed of proteins or parts of the virus that are recombined or artificially made. None of these things can possibly cause the flu. Now, the reason some people, I think, feel like a flu shot gives them the flu is that when you get the flu shot, you're exposing your body to certain components of the influenza virus, which make your body react to it. And that's your body's means of protecting you from these viral infections. And so this immune response can cause fever. It sometimes can cause chills. It can cause you to have a sore arm. But that is all your body's protective mechanism that would be directed against the flu, but is directed at the vaccine, which it's faking it out to be like the flu. So that's one of the reasons you feel like that. And the other reason that's been speculated is that some people who have gotten the flu vaccine have already been exposed to the flu before the vaccine and may have developed the flu from previous exposure before the vaccine's protection takes place. So in general, the answer to that question is you can't get the flu from the flu vaccine.
Thank you for that, Dr. Migdal. And I know that, a lot of people will, I got sick when I got my flu shot. It gets me sick. And I'm glad that you did provide that clarification. They're not getting sick. It's their body's immune response, a natural response that should be happening. So thank you so much for that. All right. So our next question. Do I need to get the flu vaccine every year?
Okay, well, the answer to that is we do need to get the flu vaccine yearly. And there are several reasons for that. The first reason is, just like we've heard about with the COVID vaccine, the flu vaccines undergo mutations and change and become different vaccines from year different. The flu virus undergoes mutations and changes and becomes a different virus to some degree every year. So at the beginning of every flu season or before the flu season begins, scientists try to anticipate which form of the virus will be present the year that you're getting the vaccine. And they modify the flu vaccine to make the body react to that specific kind of virus. So since the virus changes every year, the vaccine needs to be modified every year also. And that's one of the reasons you need to take it yearly to protect you against the current strain of virus. Now, the good thing is also that our bodies are amazing in that when we react by producing an immune response to a certain virus or bacteria or things like that, one of the things that happens is memory cells are created. So once you've been exposed to a virus or a germ of any sort, generally your body not only has the acute response to it to try to protect you, but also creates some memory cells that exist from and are maintained in your body from year to year. The previous year's vaccine has stimulated some of those memory cells, and even though the virus this year may be different from the one last year, it still helps the current flu vaccine produce a good response. So essentially, previous flu vaccines create a booster response for the vaccine you're getting this year. So getting it every year also protects you even more because you have the protection from the year before and you're getting the new protection currently. And then finally, this year is a little different because in past years, when you've gotten symptoms of the flu, most everybody would recognize that it's the flu. So if you presented with the typical flu symptoms, fever, chills, cough, and fatigue, during the flu season, pretty much your physician would be able to tell you that this is probably the flu without doing any specific testing. But now with COVID circulating, and as you saw from Alex's presentation, the COVID virus produces symptoms that are almost identical to that of the flu. And so getting a flu vaccine and protecting yourself from the flu prevents the confusion of the possibility that if you have COVID, that it's not the flu. And so the more people that develop flu symptoms, the more testing has to go on to separate the flu from COVID. And having the flu vaccine kind of makes you pretty certain that you're dealing with one or the other because you know you're protected against one. And ideally, you want to get the COVID vaccine, of course, and that eliminates all of the confusion.
Thank you. Thank you. All right, next question. Does a flu shot contain a vaccine for COVID-19? Another big one. This is one that I would hear in the community last year when we were doing the flu vaccines, and people were very hesitant because of this very question. So this is very timely.
So the vaccines are totally separate. COVID vaccine is completely separate from the flu vaccine, and nothing about the flu vaccine has anything to do with COVID, and nothing about the COVID vaccine has anything that could protect you from the flu. So essentially, you need to get both vaccines if you want protection from both viruses.
Thank you. We have a question here from Ms. Holly Riley. Hello. Some suggest that it's okay to have both vaccines at the same time, flu and COVID, but in different arms. What are your thoughts about that? Thank you, Holly.
This is some information that's relatively new this year. Last year, when we were talking about this, it was stated that you should not get both vaccines at the same time because there wasn't enough data available for us to understand the complications of the COVID vaccine at that time and whether or not one vaccine would interfere with the other. This year, the CDC has come out with a recommendation that it is possible to get both vaccines at the same time. And again, as Holly mentioned, if you get it, the sites have to be different. They have to be separated from each other. So usually it would be both arms. Now, I think there's no evidence at all that getting both vaccines at the same time make you sicker or can cause problems. That's for sure. So if you chose to get it at both times, maybe one reason for that would be you can only come once to get a vaccine. And you know you're not going to be able to make it back for the flu vaccine when you get the COVID, or you get the COVID and you're not going to be able to get back to make the flu. That would be a reason to get both at the same time. On the other hand, there are side effects from each vaccine. You're going to have a sore arm, and from both vaccines, almost certainly, that's what everybody gets those, and maybe some chills and fever, that kind of stuff. So you might be, if you have the choice and know you can get both vaccines in a timely fashion, you could easily separate them by time, and that would be fine also.
Thank you for providing that information. I know that that was a big one as well. All right, our next question. Are COVID-19 booster shots advised for people with kidney disease?
Okay, well, there's lots of new information about this, and there's been research going on since the virus made its appearance, and since the vaccines made their appearance, about whether or not you could improve the effectiveness of the vaccine. The first thing we know is that patients with kidney disease are one of the groups at highest risk of developing serious complications if they get the virus. So not only getting the infection, but having kidney disease makes it more likely that you will have severe disease, which might require hospitalization and could even cause you to die. And because of this, we have to be really concerned about whether or not we're being adequately protected from the vaccine and whether boosters would help. The one thing we know now is that patients with kidney disease are immunosuppressed, and I think Alex mentioned that in her presentation. And because they're immunosuppressed, it's been quite clear that even patients with chronic kidney disease, dialysis patients, and transplant patients all have problems responding to the vaccine as well as healthy people do. It's not that they can't respond, it's just that the level of their response is not the same as somebody who is completely healthy and gets the vaccine. So what's been looked at recently is if you get the first 2 doses of the vaccine, if it's an mRNA vaccine, and you generate some antibody response, we know it won't be as good as somebody who doesn't have kidney disease at all. So now what's been become apparent is that for some patients with kidney disease, and there's still data developing about this, but for dialysis patients and transplant patients, that a third shot or a booster can improve your ability to fight the infection further. So patients with kidney disease are one group now that have been recommended to get a booster vaccine by the CDC. And this data has just, as you know, recently come out last week. So I think there's no question now that not only should patients with kidney disease be vaccinated, absolutely, for both flu and COVID, but with COVID, they also ought to be getting a booster vaccine if it's greater than 6 months after their last vaccine.
Excellent. Thank you, Dr. Migdal. And I know that this audience is also geared toward caregivers of those or just people who love someone with kidney disease. And I know that as a village and households, we all help make decisions. And so I think that this is some really good, answers to some questions that a lot of those who are caring for people with kidney disease, and even those with kidney disease, could really benefit from in terms of decision making. Thank you for that. All right, let's look at our next question. Are any COVID-19 vaccines considered more effective for people with kidney disease?
I don't think there's any evidence that for patients with kidney disease specifically that one vaccine is better than the other. There are some data that have recently come out that have demonstrated that the Moderna vaccine seems to produce higher levels of antibody and may be more effective than some of the other vaccines. In terms of patients with kidney disease, we don't know the answer to that yet. And we also don't know that just because antibody response is better, that doesn't necessarily mean that protection is that much better also. I think the important thing to remember is that if you have a chance to get the vaccine, any vaccine, you should get the vaccine that you have that's available to you. You shouldn't be waiting for a certain vaccine to become available before getting vaccinated, because any vaccine is better than no vaccine. And there's great data for all of the vaccines that they protect you from getting severe forms of COVID and from dying from it. And that's really what we're interested in. These breakthrough infections that everybody is hearing about are basically people demonstrating that they have virus in their nasal passages, or maybe they even have very mild disease. This is not a failure of the vaccine. These are actually a sign of success of the vaccine, because the people that are getting these infections, if they weren't vaccinated, might very well have gone on to develop infections that place them in the hospital and in the ICU and on a ventilator. So these actually are not failures of the vaccine, they're a success. They should not be a reason for anybody to ever choose not to get a vaccine, because I've heard this many times, well, the vaccines don't protect you anyway, so why bother? Well, they do protect you. They protect you against dying, and that's what you're interested in.
Absolutely. That's so powerful, Dr. Migla. It's so powerful. And I like how you're introducing this narrative, or just helping change the narrative of breakthrough infections. It's not that they're failures, but they're a success, because it's keeping people, out of the ICUs, off of ventilators, and alive, which is the goal. Thank you. All right, so we have a question from the audience. Does the flu vaccine have a better immune response than the COVID-19 vaccine for kidney transplant patients? Good question.
Yeah, it's a great question, to which the answer is not that clear. The first thing is that we can't really compare the response of flu vaccine to the response to COVID vaccine, because there are different kinds of vaccines and they're different viruses. The one thing we do know is that the vaccines that we now have available for COVID are the most effective vaccines that probably have ever been developed. And that includes even vaccines for childhood illnesses that we've been getting for years. They're very specific for COVID, and they're extremely effective in preventing you from getting serious complications. We do know that the flu vaccine also protects you from getting serious complications of the flu, being hospitalized and such, and to some degree from getting infected. But the flu vaccine doesn't have the same degree of effectiveness as the COVID vaccine does, for the reasons that I mentioned before, that flu vaccine the flu virus changes every year. And so the vaccine protection is basically based on the assumption that we're going to be able to guess what virus is around. So while flu vaccine isn't as good as the COVID, it's still very effective for flu. And of course, flu is, in terms of a disease process, isn't as dangerous as COVID is. So in terms of that, I would say that you can't compare the two. They're both very effective vaccines. COVID is just superb. In terms of kidney transplant patients, that's a whole separate issue. But I think in general, for transplant patients, they have not as good a response to any vaccine that requires you to generate an immune response. There are data coming out now about transplants and COVID vaccine in terms of boosters. We know that when transplants get the first and second vaccine, they may respond poorly to the first, better to the second. And now there's a question about, does a booster make them respond even better? And the answer is, for many of them, yes. But there are still a certain number of patients, even well vaccinated, that don't have a great immune response. But I think probably the data would probably be similar for the way they react to flu vaccine and COVID. But I don't know that there are a lot. You certainly can't compare the two vaccines. You have to look at them separately. They're both indicated in transplant patients, though, for sure.
Mm-hmm. Absolutely. Thank you for that question. All right, we have a question from Ms. Tanya Smith. How late in the year can you get the flu shot to have max protection? It's a great question, Tanya.
Good question, Tanya. That's right.
Mm-hmm.
So here's the actual the answer to this is that you should try to get the flu vaccine early in the flu season to protect you from what's likely to come. even if you can't get the flu vaccine early in the season, flu still occurs as late as May in some seasons. And even if you don't get it in October or September or October, getting it later in the year still gives you protection against the potential infection. So you should get it whenever you can, up until the time when the flu season ends. But earlier is better.
Mm-hmm. Thank you. All right, we have another audience question. Are there any long-term side effects for either vaccine for people with kidney disease?
Well, both vaccines do have side effects. Most of them are mild, as we talked about, and they're flu-like symptoms. With the COVID vaccine, there have been some, with some of the vaccines, there have been some more serious side effects, like the development of myocarditis, which is an inflammation of the heart muscle, and something called a Guillain-Barré syndrome, which causes muscle weakness and paralysis. Even those very severe complications, if they were to occur, and they're very unusual, they seem to be short-term, and recovery from those seems to be the rule. So in terms of long-term side effects from either vaccine, I'm not aware of any.
Awesome. Thank you. Well, these have been some very great questions. I know some of them I've shared. Some of these questions I've heard in the community while doing, some vaccine work. Dr. Migdal, we're very appreciative of you taking this time to answer those questions. Thank you, audience, for those questions. Now, I would like to bring up Michael to talk a bit about his story. Welcome, Michael.
Hi, how are you?
I'm well, thank you. How are you?
I'm well, thank you.
Good, good. Michael, can you take some time to tell us a little bit about yourself and your story?
Well, yeah, my name is Michael, obviously, and I live in Lansing, Michigan, although right now I'm in Mobile, Alabama, visiting family. But it was in my freshman year, while attending Tuskegee University, I got diagnosed with kidney disease. One day I was fine, the next day I wasn't. And I've been living with kidney disease since then. And in 2006, which is hard to believe, it's gone by so quickly, I received a kidney transplant from a living donor, a very special family member. And I've been, dealing with that ever since. Let me back up. In 2001, I was on dialysis. I did peritoneal dialysis. And I did that so I could remain active. I traveled a lot, and I didn't want to be having to schedule dialysis sessions at different clinics throughout where my travels took me. So I did a peritoneal, so I would have things shipped to me, or I would take them with me. And then, as I said, 5 years later, I had a transplant. And so here I am now. I'm blessed to still be here. But as Dr. Migdal was talking, something I realized about misinformation is that it's human nature. And I went through this after my transplant, that I went into rejection, even though my kidney was given to me by someone close to me, my body still rejected it. And so it's human nature to reject that which is foreign to us. And so a lot of the information that we're receiving about the vaccination for COVID, as well as the flu, is being rejected because it's foreign to us. And misinformation is the result, or results rather, in mistrust. And mistrust leads to missed opportunities. And regrettably, those missed opportunities result in missed loved ones. And so when you look at the COVID rates, I believe Alex quoted something about the flu filling up Madison Square Garden early on in the COVID campaign, but this crisis. I drove through Ann Arbor and I rode by the big house, and I thought, wow, we've lost, at that time, it was a couple of 100,000 people. That's 2 game days at the University of Michigan, if you think about that. And now I think we're over 600,000. So that would be an entire home football season at University of Michigan, where people who have left us. And so perhaps we can do things by taking this vaccination. I was reluctant initially to take the vaccine because of misinformation. As I stated, I went to Tuskegee University, and while at Tuskegee, and Alex talked about it just a little bit, Tuskegee experiment. I had no idea about the Tuskegee experiment until I went there as a student, and I heard from people who had loved ones who were impacted by the experiment. So again, that misinformation was a contributing factor to me being a little bit reluctant. And please, I don't want to go over my time. And then also just general mistrust and not certain, information was changing so often. But I realized that a lot of times we equate new information with misinformation. Mm-hmm. This is COVID-19, given the 19 because it was just discovered in 2019. But the influenza vaccination that we're talking about was a result of the influenza outbreak of 1919. So they've had 100 and something years to develop that vaccine. So there's going to be new developments that unfold for the next, for the forthcoming future about this vaccination. So we just need to, trust the information as best we can and research and recognize that, the science is there and trust the science. So for me, I had family members encouraging me. I was a little reluctant. My doctor was encouraging me. I was a little reluctant. But then one day I was watching the news and I saw a man laying on his deathbed, and the reporter asked him, what would you do differently? And he said, I would get the vaccine. And it was then and there that this man who looked like me, that I went immediately. I was getting dressed to go to work, and I went immediately to the pharmacy to get that initial shot, and subsequently, a couple of weeks later, did the second shot. So I hope I didn't take too much time.
You didn't, but wow, let's talk about your aha moment. Usually we kind of listen to people's stories, and we try to frame it in different ways to get the aha moment, and yours was just blaring. You saw this gentleman who looked like you, and he's on critically ill, and says get the vaccine, and you're like, what, all this hesitation that I have, all
Right.
these without misinformation, new information, you decided that was your aha moment.
That was it. Yes.
Yeah, that was it. Wow, that blew me away. So you mentioned, Michael, that you attended Tuskegee University. So tell me, as a Black male, especially one being in that space, that historical trauma space with the Tuskegee experiment, tell us about that experience in relation to you deciding to take the COVID vaccines. I know you mentioned that hesitation, you mentioned your aha moment, but talk to me a little bit about that.
Well, again, that I learned about that experiment over 30 something years ago as a freshman. And you have people who were hurt, perhaps traumatized. Then you had groups of people who came from all over the country, and you are enlightened to different things. And so that information from all those years ago stuck with me. And then when COVID came up, a couple of years ago, and they're talking about the vaccination, it's almost like that mental Rolodex automatically went back to those times. And it's not just Tuskegee, but there are other incidents that we won't get into of distrust, mistrust among the African American community from the government treatment. And so you have that thinking, and then also recognizing that our community, the African American community, and it's not necessarily just African American community, but sometimes it's more an economic issue. Have less access to medical care. And let me just back up. One other thing that kind of led to my mistrust is that this was free.
Yeah.
One of those things I did, learn from Tuskegee or heard from Tuskegee as it related to the experiment, like don't take anything free. In fact, I was reluctant to even, if McDonald's had a Big Mac to get buy one get one free, I'll just take one. I'm good, thank you. So
yeah.
but that's the
Culturally,
reality of it.
that's kind of where we are with that. That's
the
how we do.
Right. So why is this free? What is your angle?
Right.
And of course you hear all these conspiracy theorists and things of that nature. But the bottom line is, there's nothing 100%, but it's best to have it. It's almost like insurance. It's better to have it and not need it than to need it and not have it. And so there are breakthrough cases and so on and so forth. But if we can, I'd rather lose a game, and not that this is a game by any means, but when I did compete in sports, I'd rather lose a game by 100 points than by forfeit.
Absolutely.
And so sometimes I think we are forfeiting our opportunities. And also you have to have a litmus test, so to speak, of where is this information coming from? And a lot of people who are celebrities misuse their platform. And I'm not going to name any names, but one particular celebrity a couple of weeks ago, I believe it was, said that there was a certain symptom from the vaccination, and it turns out it was from her babysitter's cousin's nephew's dog groomer or something. So where do you get your information? But we have to vet our information.
True. And I like how you mentioned the difference between misinformation and new information, because this is ever evolving, and we're learning about this virus in real time. And so, yes, there's going to be some new information that a lot of people are misconstruing into misinformation. So I'm glad you brought that up. And then also you mentioned, about talking to your doctor. And that's great. Anytime that we can encourage people to talk to their doctors and just normalizing that it's okay, to ask questions. So great, Michael. Thank you so much. Thank you so much for sharing your story. I want to bring up our other panelist, Linda Kilduff as well. Linda?
Hi.
Welcome, Linda.
Thank you.
Yeah, thank you so much for joining us. I'm sure that there are parts of Michael's story that you can relate to as a caregiver or someone with kidney disease. But can you tell us a little bit about your story, Linda?
Well, I'm a mom of a beautiful young lady now, and her story started back when she was born. The doctors told me she had a VSD, which is a hole between the lower chambers of the heart. And I thought, oh my goodness. But they, told me that it could even close on its own. 24 days old, she started having issues, and I was told that she was in renal failure. So that was quite a shock. They took her to Children's Hospital, and by the time she was 9 months old, she was doing peritoneal dialysis. She's the second youngest at Children's to be put on dialysis. We looked into being her donors. Well, I didn't match, but my husband did. So he was being worked up to be her donor. She was small. He's a big guy, so we had to wait a little bit. She did end up going into the hemodialysis part. And in the process of getting her ready for her dad's kidney, they did a surgery and she had some major bleeding, and they told us that she would also need a liver transplant. So Dad was put on the back burner, and our Dr. Fleshman was our doctor at that time. And he told us, well, we're not doing double transplants in Michigan, so it's either Pittsburgh or Minnesota. And I asked him, I said, I'm a new mom. I have no idea. Where would you suggest going? And he said, University of Minnesota. So we packed our bags, and my husband took us to the airport to go there for a 2-week workup. And he took off and stayed home because he was starting a new job. So we were there in October, actually October 5th or 4th, which is coming up, an anniversary here. And it was January 15th of 88 that we got the call, and just in time because her health was going downhill, and she had the double transplant. The kidney was on the small side, so it worked fairly well through the surgery, and 6 months later she was back on dialysis. Her dad was, of course, going to be her donor, so we waited a year to let her get a little bit healthy, and then her dad became her donor. And after that, she had a pretty good health, as pretty good as you can be when you have that kind of situation. They did tell us during the workup that she had some issues with her aortic valve and that she may need surgery in the future. Well, the future was like a year after that she had her aortic valve replaced and a pacemaker put in, because she coded in the hospital, thank goodness. And so she had it as a backup. And she did well, went to school, and it was in her senior year in high school that her mitral valve started having issues. And we, instead of waiting till like summer, we had it done during the holiday break. And she graduated with her friends, which was great. And she was doing really well up until 2019. Sorry. Her dad's kidney started failing. So she's back on dialysis now. We tried to do peritoneal, but it wasn't working for her. So we're doing hemodialysis at home. And one thing we always did was get our flu shots every year, because if something happens to us, who's going to take care of her? And vice versa. We needed her to be healthy. So we've always trusted our doctors to lead us in the right direction. And they always have, with a 10% chance that she would survive back in those days. She's going to turn 37 in December 1st. So they've brought her through this far. So we trust them in what they suggest. As soon as they were talking about a vaccine, Allison was asking at her dialysis unit when she was doing in-stay, when are we going to get the shot? And she got her first shot and her second shot there in the unit. And then we started home dialysis, and she waited the 6 months since her second shot. And last Friday, she got her booster shot. So she feels very secure with that now. She hasn't got her flu shot yet, but we have an appointment. She usually gets it when she goes for her checkups. So she'll probably get that then. Her dad was the first one with his hand up to get the shot. He just, give it to me right now. And so we both got our shots together, and we've had two. And I think today, in fact, is 6 months for us. So within the next few days, we'll be getting our booster shots. And then I think I'll wait a couple weeks and then get my flu shot for that. But yeah, we've been very blessed with doctors that we've had a lot of faith in, and we trust what they tell us to do, so that we can keep her here with us and healthy and happy. And my husband's a real advocate. We have a neighbor next door that ended up getting COVID, and she was in the hospital, but I don't think she was on a vent. And just the other day, he was talking to her, and he's asked her, he said, have you gotten your COVID shot yet? And she said, no, I'm still not, sure. And he says, well, I heard a doctor on the TV the other day, and he says, I can fix COVID symptoms. I cannot fix dead. And just a few days ago, she caught me as I was coming in the house, and she goes, "Tell your husband I got my shot." So yeah, and that was like, okay, this is great. So if you can talk to people, and I mean, that's all you need is a line like that. You can't argue with, you want to be feeling a little bad, or do you want to be dead? So
Yeah.
yeah.
Awesome.
Yes.
Thank you so much, for that story, Linda. I'm sorry, were you adding more?
Nope, I can't think of anything else.
Yeah.
But I just want people to know that you have to trust the medical and the science. I mean, even in the past with the different diseases and things that we've had, people got their vaccines and that went away. Maybe not completely, but where it was controllable. So I think we need to do the same thing with COVID. We just gotta get it done.
Get it done.
Yeah.
Something that I've heard similar between you and Michael's story is trust and talking with doctors. And so I'm happy to hear that you talked about trusting your doctor. A lot of times we have that white coat syndrome, where you just kind of freeze up and you just listen to the doctor and you do it because they told you to. And it sounds like that wasn't your case for your family, is that you did it because out of trust and out of understanding and out of wanting to care for, each other, but specifically for Allison.
Right.
So it sounds like you guys have been through so much. So
that's
tell
why
me,
I don't have time to look this up and do all the scientific stuff. I'm taking care of her, so I depend on the doctor to give me the information I need to take care of her the best way I can.
And speaking of which, taking care of, I'm a firm believer in self-care. I've taken self-care on the road and I do lots of self-care work. Tell me, how has your self-care journey been over, this experience with your daughter? It sounds like there's been a lot. Tell me about that, your self-care during this time.
Well, up until COVID, I was an avid exerciser. It's I just believed that I had to keep in shape in order to take care of her. So I belonged to Curves. I even got a job there so that I could have some time to my, out of the house and talking with other ladies and, that type of thing. And I try my best to eat properly. I have never been thin. I've always been overweight. So I'm still working on that. Some days are better than others, but it helps to have that outlet just to rev your body up to get rid of that tightness that stress gives to you, So to be able to work out or even just go for a walk. I used to walk about 3 miles a day back in the day when at the village, Greenfield Village, with a friend. And I think that would be my most thing to tell people who are caregivers. You do need to exercise or go for a walk, just to clear your head and kind of step away from the caretaking.
Absolutely. Absolutely. Thank you for that. Thank you for sharing that. So I understand that we had another question that came up. I think, is this for Michael? We'll see. Okay. So here's our next question. It's from Tanya. Yes, it is for Michael. As a kidney recipient, what steps do you take to protect yourselves from the flu and COVID besides the vaccine? Michael, I think you're muted.
Sorry about that.
No problem.
One thing that COVID-19 has done is made me more cognizant of things that probably I should have been doing anyway. And that's maintaining social distance. You know, I'm pretty good at washing my hands, but I tend to wash my hands more. I carry hand sanitizer with me, all types of hand sanitizer, the little one-use packets, the wipes and everything. I'm Lysoling everything in my office. It was mentioned I work in education, so this is typically the time of the year that I get sick anyway.
Yeah.
From dealing with young people. Last year was the first time in over 20 something years that I didn't get sick. Not from not being around, young people. But I wear a mask. I wash my hands constantly. I have hand sanitizer. I limit my unnecessary going out and limit being around people. As I said, I'm in Alabama, and I actually came down here for a football game. Alabama A&M versus Tuskegee is my first football game in years. But I was intentional on sitting far away from people and having a mask. So those type of things I'm more conscious of. And it's interesting, if I find myself coughing after being around people, I'm nervous for a little while. So that's what I do. I hope that answered your question.
I have
I'm
I have
sorry.
to, I have to agree with Michael. We're like that here too. I mean, when COVID first came out, my husband was the only one that left the house and did the shopping and brought enough food for the week so that we didn't have to go out. And he said, you're taking care of her. I do all her medical stuff. And he says, if something happens to you, I'm going to be up a creek, because he says, I don't know how to do that. So we stayed in the house. We didn't let anybody in the house at first, but we're very conscious. We wash our hands as soon as we get in the house. We use sanitizer after, when we get in the car after shopping, on our hands. I think that is the best thing you can do to protect yourself, and to wear your mask.
Exactly.
I felt weird wearing my mask in the grocery store, because it says you didn't need to wear it if you're vaccinated. And I thought, I hope people don't think I'm not vaccinated. I wanted them to know, yes, I'm vaccinated, but I'm doing this to protect my daughter, because she has health issues, and I don't want to bring anything home that's going to cause her issues. So, yeah.
And if I may add something real quickly, Linda, you mentioned wearing a mask, and I neglected to say that I wear my mask, and I wore my mask. And the vast majority of the stadium, this particular game, had their mask. But sometimes we have a tendency as humans to yield to pressure. And there's a certain pressure in society to not wear masks. But you have to take your own self-care, as you talked about, and be confident in who you are, and not worry about the looks and stares that you may get, because there's no vaccine detector. We can't look and see, oh, they're vaccinated, because the reality is, just because you don't wear your mask, it doesn't mean that you have been vaccinated. So,
that's so true.
Yeah. So, I wear my mask. I used to be a little mask shame, if you will, but now I'm like, hey, it is what it is.
I agree. I think wearing your mask, whether you're vaccinated or not, shows that you are caring for your fellow people that you're coming in contact with. Just like the gals that are at the stores, they may be vaccinated, but they wear their masks anyways. So, yes, I have to say I have gotten past that a little bit, but I think wearing a mask, especially if you're a kidney transplant, Allison wears hers all the time when she's out. So, yeah, we're advocates for wearing a mask and being safe.
Got it. Great. Thank you. We actually had a YouTuber text a question that was just answered. So you guys are right on the ball. Awesome.
Great.
Awesome. Linda, Michael, thank you so much. Did you have anything else to share or add before we wrap up?
I just want to, thankful for the opportunity. Thank just everybody, and I encourage, if you're not vaccinated, anyone out there, do the research and make an educated choice.
I agree. I think you have to listen to those who know and not Facebook. Social media can be very good, but can be very bad. But I ask your doctor and believe what he tells you.
Awesome. Thank you so much. Thank you, Michael. Thank you, Linda. Thank you, everyone, for joining us tonight. Thank you, Dr. Migdo. Thank you, Alex. Thank you, everyone, for tuning in with your great questions. It looks like we are just really moving along, and I would like to thank all of our panelists for sharing their knowledge and their stories. For those of you who are asking, there are lots of places to get vaccinated in the coming weeks. Check out some of these events. And also, you can visit www.vaccines.gov to find a provider near you. Finally, I would like to draw a name we would like to draw a name from everyone who pre-registered for this event. The winner will receive a gift card from the National Kidney Foundation of Michigan. Thank you again to everyone who registered for this event and for your wonderful questions and for joining us this evening. You are all winners. So let's see. Let's see who's going to be our winner. Is that Farrah F? Congratulations, Farrah F. The National Kidney Foundation of Michigan will reach out to you via email. Congratulations to you, and thanks again to all of our participants today. And now we're going to go ahead and wrap up. Thank you all for attending this evening. Thanks again to our wonderful sponsors for your support. If you have any follow-up questions, please visit nkfm.org. That's nkfm.org. Or you can email reach@nkfm.org. I'm AJ, and I have been your moderator for this evening. Have a wonderful night and stay safe.